Good evening, friends.
The World Health Organization, WHO, reported a stark warning that annual cancer cases are projected to spike by 66.7% by 2050, surging from 20.6 million to nearly 35 million global cases.
SEGME, the looming cancer crisis.
The big headline: the World Health Organization, WHO, has dropped a definitive report.
Global cancer rates are on track to climb by nearly 67% by the year 2050. The inequity gap: the data shows a massive divide.
In high-income countries, the 5-year survival rate for breast cancer is 87%. In low-income nations, that number crashes down to just 42%.
Less than a third of nations worldwide offer comprehensive cancer care under universal coverage. The shift to survivorship: experts warn that the medical system is about to hit a second hurdle.
It is no longer just about surviving cancer treatments, it is about managing long-term health, tissue damage, and chronic side effects for tens of millions of new survivors globally.
Segment 2: AI and robotics take the operating room. Humanoid robots debut. In a stunning technological leap, a humanoid robot named Sergi has successfully co-performed its first-ever human surgery.
The procedure, designed by researchers at the University of California, San Diego, the robot was teleoperated by a trained surgeon to remove a human gallbladder. Right after, a pair of these robots autonomously handled laparoscopic gallbladder removals on non-primate test models. The impact: this proves humanoid mechanics can navigate tight, complex internal spaces. This opens the door to fully remote surgeries in isolated, rural, or emergency war zones.
Segment 3: Flash FDA approvals. Bladder cancer expansion: the FDA has expanded its approval for a potent combination treatment. Merck's pembrolizumab, marketed as Keytruda, used alongside Padcev, can now be given before and after bladder removal surgeries.
It is no longer restricted to patients who cannot take cisplatin, it is open to all muscle-invasive bladder cancer patients facing surgery.
Myeloma goes subcutaneous: multiple myeloma treatments just got a lot faster.
The FDA approved a new subcutaneous, under-the-skin injection format of Sanofi's isatuximab Sarclisa Eschina.
This avoids long hours hooked up to hospital 4 lines. Trutacna for kidney disease: earlier this week, the accelerated approval of Vera Therapeutics' drug Trutacna made history. It is the first therapy of its kind targeting specific dual proteins to safely lower protein levels in adults suffering from progressive IgA nephropathy. Segment 4: Gut microbiomes and vision breakthroughs.
Predicting type 2 diabetes: new clinical trial data out of Sweden has successfully pinpointed 9 specific gut bacteria profiles that directly flag future type 2 diabetes risks. Interestingly, scientists noted that the common gut bacterium A. mucinifila switches roles based on diet. If a patient eats a low-fiber diet, it sparks cellular inflammation. If they eat a high-fiber diet, it actually protects them.
Metamaterials rewriting MRI science: scientists have used synthetic metamaterials to completely redesign standard MRI receiver hardware. This allows current scanners to map incredibly fine, notoriously difficult to see structures in the human eye and brain fovea in a fraction of the usual time. This means much clearer diagnoses for macular degeneration and early strokes without forcing patients to sit still for an hour. Dermatitis herpetiformis, also known as DH and During's disease, is a chronic skin condition caused by a reaction to gluten ingestion. The vast majority of patients with DH also have an associated gluten-sensitive enteropathy, celiac disease. Extremely itchy bumps or blisters appear on both sides of the body, most often on the forearms near the elbows, as well as on knees and buttocks, and along the hairline. Celiac.org. The impact of congenital measles.
Congenital measles occurs when measles virus is transmitted from the mother to her neonate, typically when maternal measles infection is within 10 days of delivery. Unlike rubella, measles during pregnancy is not associated with congenital defects. Rather, congenital measles presents in the first 10 days of life with fever, maculopapular rash, and potentially severe complications including encephalitis, pneumonitis, hepatitis, and death. Neonates are also at increased risk of developing early subacute sclerosing panencephalitis, SSP, a rare, 7 to 11 per 100,000 measles cases, but fatal degenerative disease affecting the central nervous system. SSPE is characterized by intellectual and behavioral deterioration and seizures that develop 7 to 10 years following measles infection.
Mortality is 100% within 1 to 3 years of onset. Medscape.
Studies pointing to endometriosis as an androgen-dependent disorder and highlight 11 oxygenated androgens as potential diagnostic biomarkers * in future therapeutic targets.
Academic.oup.com. Segment 5, Outro and Actionable Summary.
From AI-driven humanoid surgery to massive global warnings regarding cancer management, medicine is shifting toward data-heavy and automated care.
Call to action. Which of these breakthroughs do you think will change your daily life first, robotic surgery or targeted gut health? Drop a comment below, hit subscribe, and share this video with anyone who needs their daily dose of health innovation. This content is for educational purposes and is not a substitute for professional medical advice. The audience must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm. Disclaimer: compiled information.